So let me introduce our chair of the first panel, Professor Kate Jones. She is running the Peoples and Nature Lab, and she's one of the leading world ecologists with interest in IoT technology, digital agenda, and modeling of diseases. And she's going to introduce the panels as they sit around. So do you want panelists to come forward?
Could I ask the panelists to come up? So thanks very much, Patty. It was an absolute pleasure to be invited to chair this panel. So I'm Kate Jones. As Patty said, I'm an ecologist. So what am I doing here? So I guess I've been really interested in how we monitor biodiversity and understand the consequences of land use change, of biodiversity loss. And I've been doing that for many years. And I suddenly kind of got interested in what the consequences are of understanding land use change and biodiversity and climate change. And that's where kind of this One Health agenda got me really interested. And I kind of, these kinds of streams clashed of the One Health and the biodiversity monitoring. And I've spent a lot of time thinking about how we understand a systems thinking approach to ecosystems and understanding how climate change and land use change are all interconnected, and thinking about how land use change changes those interactions between species and how that means that our health and our well-being is impacted. And so taking a really different approach to public health than is normally done. But having kind of that perspective has really helped me think about forecasting, and that's the kind of the theme of the panel debate, is trying to understand how you think about getting all those data from the environment, how you understand how species are interacting with the environment, and how climate change and land use change is impacting those interactions to then interact with us and think about how disease then emerges into human populations. So it's all about how interactions between species, well, I can't believe I'm sitting here as an ecologist, but from my perspective, it's about how interactions between species change that dynamic between humans and the environment, and that impacts our health. So what I want to do in this panel is introduce our amazing panelists, and then really think about, you know, what are their perspectives, where are they coming from on this panel, and see if we can draw together some of those perspectives together to think about the future and what is stopping us forecasting and understanding what's going to happen next. Why did we get surprised by COVID, and why are we, you know, why doesn't everyone know that dengue will be in this country within a few years? So, like, what are the kind of bottlenecks to think about for the future? So I'm going to stop talking and turn over to my first panelist. Would you like to introduce yourself?
I am Bruna Gouveia. I come from Madeira Island. You have already seen what it is, how it is organized in terms of health. I'm the regional health director. So my institution is responsible for disease surveillance and health planning in the Madeira region. So we share the same preoccupation, the same worries that that you have spoken here. In terms of vectors, we have some experience with the vectors, namely the Aedes aegypti, that is present in our islands since 2005. So we have several years of surveillance and control activities in regard to this particular vector. And what we've seen is that intervention is, we know what we should do in terms of surveillance and control. However, the challenge is getting higher every year, and we see that from our data. During this period, we had only one outbreak of dengue. We had an outbreak in 2012, 2013. We had about 1,000 cases, confirmed cases, and about 2,000 probable cases. And we spread a little bit of some cases throughout Europe, because we are a touristic place. So we know our responsibility on in regard to the risk of spreading arbovirosis related to the Aedes aegypti. So we have a continuous work done in Madeira Island. We had a surveillance system created, and it covers all our region. So we monitor positivity in our traps and density of this vector. And we have an integrated approach to surveillance. So we have an integrated surveillance that has a component in entomological surveillance with this vector surveillance activities, also environmental surveillance, because we also monitor temperature, humidity, and precipitation, and do it integratedly in an integrated way, so that we can predict the rise of the population of mosquitoes. And then we have the epidemiological surveillance with the clinical and the lab component. And also we are very connected to the importance of using different informations coming from different non-formal structures, because every time we see that in small places we are able to know about several things that happened, and epidemic intelligence is a bit of this, using this information coming from everywhere to see a big picture of what is happening. And sometimes this has been one of our targets, because we have worked all these years not only in the formal activities done by our teams, but also we have tried to raise awareness in the community and also in the health sector, because we need to be able to identify imported cases of disease, so that we can reduce the risk of transmission to our vectors who are not infected, which are not infected at the moment, but it can be. Madeira is an island. We have about 714 square kilometers of space, and we have 250,000 inhabitants. We have a high density of population in the main cities and the main cities in the south of the island, and that is where the mosquitoes are present. And in 2023 we had our highest touristic year. We had more than 4 million people visiting the island during all the year. This is a lot of people circulating from everywhere in the world. And you were talking about how land use, how interaction between people and animals and vectors relate to this risk, and mobility of people, and also other types of products that circulates all over the year, the world, are very important, and we are dealing with this. What we have seen is that our conditions for the rise of the population of mosquitoes are changing. We are a very pleasant place to be. As you know, Madeira has a perfect climate all year long. We have very little cold just a few days of cold during the year. So this is very good for mosquitoes. For this vector particularly, he's happy. And then temperature rise is happening, and we have seen the impact of climate change in the island. And from some years ago, we had a period where we had temperatures that dropped a little bit, and we had zero in our traps in regard to the presence of the mosquito. Last year, that didn't happen. So we had a season for high activity of the mosquito that happened specifically. The highest activity happened between July and October, November. But now we have activity all year, and we have higher mobility of people. So we have perfect conditions for having outbreaks.
So that was absolutely fascinating, and I think Madeira is acts as a bit of a sentinel for some of the issues which I think Europe and the world is facing too, and I think it's absolutely fascinating. So the biggest issues at the moment for making those forecasts? What do you think? What is the issue with your health system at the moment? Is it not mobile enough? Is it not integrating enough data? What are the big bottlenecks, do you think?
I think that we have a lot of data collected and we have given it less use that we could do. I think that we have to use our data in a more profitable way. And this discussion on digital transition this view of opening is also a view that we see that is important in this area. We have, during this time, we have looked up to the surveillance, but also emergency preparedness and response to outbreaks. We have been preparing the system. We had a response already, and fortunately it went very well. We have, as you've seen, in Madeira, we have invested a lot in our health system. We have invested a lot in promoting capability of our personnel in regard to response to incidents and major incidents. So we are trying to be prepared. However, we are still very committed to control measures. We have now seen a less adherence of the population in regard to control measures. So, since the outbreak is many years ago, people have forgotten about that. So there is less contribution of the population. So we have a lot of activity on communication, trying to raise awareness. I think that's an important challenge.
So maybe I can bring in my next panellist, just because I think there's quite a lot of connection there between the issues you were raising about we have a lot of data, but not the kind of information that we need from the data. So would you like to introduce yourself?
I'm Ella Browning. I'm a postdoctoral researcher. I'm now based at the University of Oxford, but I was previously here at UCL in dPHE with Patty and also working with Kate in SEBA. My background is also as an ecologist, so I'm really interested in understanding impacts of environmental change on biodiversity and quite specifically impacts of anthropogenic environmental change, so habitat loss, land conversion, sort of intensity of land use, and particularly things around urbanisation and all of the other sort of factors that come with that, as well as the interactions between all of those things with climate change. And my sort of interests are in sort of understanding how those things are affecting biodiversity so that we can identify measures to reverse biodiversity loss. So why am I sitting here? So something that I sort of became more and more aware of in my sort of research is that biodiversity loss and those impacts also have effects on human health and well-being. So where we have higher levels of land conversion, higher levels of urbanisation, we're also seeing higher levels of disease and zoonotic outbreaks and things like that. And there's also the interactions between species and how they use urban areas, and how urban areas are sort of creating these environments which are becoming really sort of well used, and there are a lot of species which are adapting to using those urban environments, and how does that interact with public health risks as well. So mosquitoes are a sort of particularly good example of how a lot of mosquito species are adapting really, really well to human environments. They're sort of changing their ranges and expanding into areas that were previously unsuitable because of human land use change. So they're able to use urban areas in sort of climatic zones that might not otherwise be suitable. So I'm really interested in how humans are changing the landscape and making it more suitable for species which are then increasing disease risk and causing public health outbreaks and public health issues. And the way that I sort of am really interested in understanding these issues and actually sort of identifying the factors which are increasing the risk for humans and also affecting biodiversity is through modelling. And I'm particularly interested in sort of spatial and temporal patterns in biodiversity and spatial and temporal patterns in disease vectors. So thinking about, what environmental factors increase the risk of mosquitoes being within the landscape, and particularly within the urban landscape. And that's things like the level of water cover, the level of vegetation cover. But then there's also, particularly with mosquito vectors, there's a lot of socioeconomic factors which also will influence the sort of levels of abundance particularly within an urban landscape. And things like sanitation and sort of human behaviours have a huge effect as well. So I'm interested in using models which take into account temporal changes in their populations as well as the spatial patterns in their populations. So one of the areas I was working with Patty and Kate under the MIWA project was initially looking at mosquito populations and abundance across cities in Brazil. And so trying to use data collected across these cities to identify where there would be hotspots of these mosquito vector populations, with the aim of then targeting public health workers to be able to reduce those mosquito populations. That was the idea, was to combine sort of those sort of neighbourhood survey data with environmental factors. One of the challenges we really faced with that project was just the resolution of the data availability. So both spatial resolution of the data and temporal resolution of the data, it wasn't available at a resolution that was going to be meaningful and representative and useful for enabling effective action to reduce mosquito populations. So in terms of temporal population, a lot of the data for the mosquitoes was available at 2-month scale, whereas communicating and working with the public health workers and community vector control agents, that information really needs to be at a much finer resolution if we're going to be able to make predictions using these models at meaningful temporal scales, so say a weekly scale, so that they can identify quickly, okay, we need to target all of our efforts in this or more effort in this area than this area. There's also the issue of resolution of availability of the environmental factors. So weather has a huge impact on mosquito populations, both the temperature and precipitation. In Brazil, the resolution of that data, across the city is not fine scale enough. And particularly we know things like microclimate can have a big impact on all insect populations. Microclimate is really important, and especially for mosquitoes because that affects where they're going to be breeding. And that just wasn't available at the temporal scale and the spatial scale that we really wanted to be able to do these models. So I then started actually working on some data from Madeira, where you have this data at a weekly resolution, and thinking about how I could use that data to develop sort of models that would be transferable to other areas. So combining that more high resolution data with these spatiotemporal modelling methods so that we can model through a much sort of finer resolution temporally where we think those hotspots of mosquito vector abundance would be, which would then hopefully help to identify and target those vector control measures.
So using Bruno's data, what kind of things were you finding with the Madeira data? I know, actually. But would you like to tell people?
So I sort of looking across the full. So I was looking at a 10-year time scale and looking across through that sort of finer resolution in terms of sort of monthly level. We're seeing, I think, as you said, that there is a quite a sharp increase in mosquito populations in recent years, and those increases are particularly centred around those densely populated areas in the south of the island where those cities are. There is also quite an interesting interaction where you have typically higher elevations, you would have lower mosquito populations, but where there's a higher amount of urban area where it's more built up, that negative effect of elevation is being cancelled out because the microclimates that are being created by those urban areas are making that suitable, which is also an indication of what might be happening where future climate change, where we see temperature increases, and that's kind of acting as a bit of a sentinel for what might be coming.
Thanks, Ella. Can I bring in Professor Britzi, because I think you have a different perspective on kind of meteorological modelling and climate modelling. So maybe you would like to come in with thinking about your perspective on disease and climate risk.
Yeah. In fact, I decided to bring here some data from what's happening nowadays in Brazil in terms of dengue. And yes, my name is Tercio Ambris. I'm from the University of São Paulo. I'm from the beginning with the group of Patty from the support of Belmont Foundation. And in Brazil, we got the support from FAPESP, which is São Paulo State Research Foundation. And I work with, exactly with climate variability, climate change. Well, Brazil broke the historic record for dengue death in 2024. According to the data from the Ministry of Health's Arbovirosis panel, the country recorded 1,116 deaths in the first 13 weeks of this year. This is the highest number since the beginning of the historical series in 2000. The previous record for death occurred in 2023 with 1,094 deaths. The third year was the highest number was in 2022 with 1,053 deaths. In the same period last year, in the 3 months, Brazil had 388 deaths. Furthermore, to date, we had more than 3 million cases records in the first 13 weeks of this year, an unprecedented rate. And in 2023, there were around 600,000 cases between 1 and 13 weeks. In 2023, outbreaks of the disease were detected on all continents except Antarctica. The world has recorded more than 5 million cases and more than 5,000 deaths worldwide. According to the WHO, 4 billion people are at the risk of infection from the disease. The increase in reported cases because infected mosquitoes are now thriving in new locations due to the global warming. High temperatures and increased humidity and rainfall are conditions that benefited the development of the dengue, Zika, and chikungunya transmitter. Also, unplanned urbanization in the cities, population growth, and the globalization process are factors for the increase in the incidence of the disease. Eradication at this time is not possible due to these complex factors. However, Dengue control is possible with political commitment and a multi-sectorial approach besides a vaccine recently created. Local case of the disease soar in Europe, actually. Locally acquired case grew 1,000% from 2010 to 2023 in Europe. In 2010, it was reported 12 infections according to the European Centre for Disease Prevention and Control. In 2023, there were 128 in 3 countries: Italy 82, France 43, Spain 3. And what about climate change and dengue? One of the studies showed that there is a correlation between the appearance of new outbreaks and the number of months of the year with temperatures considered suitable for the multiplication of Aedes aegypti. Furthermore, since the beginning of the century, months with sufficient heat for the mosquito's life cycle have become more common in the south region of Brazil, which coincides with the increase in outbreaks in these states. There are of influence of the disease since the area of influence of the disease seems to have moved toward the south. The females need to feed on blood earlier, soon after completing their development, and more frequently. It is estimated that the maximum frequency of stings occurs at temperatures between 30 and 35 degrees Celsius. In summary, as a result of recent climate change, mosquito-borne diseases such as Zika and dengue are becoming endemic not only in the subtropical regions of Africa and Latin America, but in other parts of the world, such as in Europe. The Mosquito Population Modeling for Early Warning System and Rapid Response by Public Health Authorities (PUR) project combined public health, mobility, technology, and climate modeling to evaluate the impacts of environmental change on water, providing breeding habitats for mosquitoes in the northeast Brazil. Therefore, it has been a privilege to be part of this project, and hopefully it will be carried on to other regions of Brazil, in particular for the São Paulo state where I live. I think the Belmont Foundation I thank you, the Belmont Foundation, for the financial support, and in particular for FAPESP, the São Paulo State Foundation Research. Also, I congratulate Professor Patty Kosokova for her outstanding leadership of the project and all researchers and students involved. This is more or less what I think.
Thank you.
Sorry.
But what are the kind of the big steps next? For you guys. Like, how would you use these predictive models? Like, what are the big stopping points for getting really big surveillance models and forecasts out there so you can actually use them?
We were discussing that in our meeting yesterday. We have to convince the authorities and the governments to take some strategic measures to do that. We could use the surveillance in the cities. I was talking about my city, São Paulo, which is the 5th city in the world in terms of population. So it's huge. Wow. So you have different areas and can have different areas of impacts of the dengue and disease. So we are working together. I have my PhD student here, Yuri, is doing some studies in São Paulo nowadays, in São Paulo city and also in 2 other cities in the countryside. So the idea is really to get all the information and try to go to the authorities and see, we know what's happening and that we can have surveillance over there and try to prevent that. Together, of course, with a good weather forecast and even a climate forecast, because you need to know ahead what's going to happen in terms of increase in temperature, humidity, and others.
So it seems like a big data challenge at the moment to pull those things together, and then there's a communication piece which needs to happen.
I think that's the key word, actually.
Can I bring in my next panelist? Because I think she has a wider perspective on arboviruses from a global perspective. So would you like to introduce yourself?
Yes, absolutely. So thank you very much. So thank you very much for the invitation to this panel, to this meeting, to the birthday celebration, and congratulations for all your achievements. I am Diana Rojas. I'm the technical lead for arboviruses in the Epidemic and Pandemic Preparedness and Prevention Department. at the World Health Organization in Geneva. I'm also the co-lead of the Global Arbovirus Initiative, which is an integrated approach to prevent and prepare and control these arboviral diseases, among others. And I'm also in charge of the grade 3 emergency response for the current dengue emergency since last year until now. And well, we are going to have a regrading call in the next couple of weeks. And I think we are extending this dengue emergency until the end of the year. So we currently, globally, we had a new record of almost 7 million cases reported so far. And yeah, we are just in May. So we really need to keep responding and preparing in those areas where there is no transmission yet to be able to control the transmission. So I think, well, you have brought several topics here. So the first one is about that, well, we might be collecting a lot of data, but we are not using it properly. So I think we need to go back to the definition of surveillance. So surveillance is doing the collection, the collation, the analysis, and using that information to actually take action, right? And sometimes we collect the data, and in many places the data is still collected in paper, and let's be real, and no one is actually putting it into a computer, so that information is not being analyzed anywhere. Also, we also need to do a better job in telling the people that are collecting the data which kind of data is useful for us to be able to make the model, or for you to make the models. I don't do modeling anymore. I did my PhD with modelers, and I did some transmission modelers, but now I feel I'm in between. My job now is to fill the gap between modelers and policymakers, to bring them all together so people can actually use those tools. So we need to do a better job guiding them in which information should they collect, so that information will be useful for the model. So for example, for new vaccine strategies for dengue, they will need to collect age-specific, age-stratified data on hospitalizations and severe cases. For the entomologists, we've been collecting larvae index since the 1940s for the eradication campaign for yellow fever. And we haven't done anything different. How are we expecting different results when we keep doing the same for 80 years, right? And probably back then, it was a plan of eradication of the Aedes aegypti in the Americas. Well, now, we didn't win, right?
I think definitively lost.
So at some point, exactly. So at some point, we almost eradicate the mosquito. There were some specific areas where there was still the mosquito in Cuba and in the north of Venezuela. And in less than 30 years, the mosquito completely infested all the Americas again. Sure. So we are doing, probably we are not doing the right thing. So we need to start changing and shifting what we do. And also, for the people that are collecting the data, we need to show them the benefit. Because sometimes they collect the data, but they don't see at the end what happened with that data. So they are working, the entomologists or the technicians that are collecting the information, they give the information, but they don't know the impact that might happen. So that might take. So if they know exactly what is the goal for that data and which benefit is going to bring to them. For example, a new tool, like the apps that you were showing, a tool that helps them analyze and maybe stratify better the vector control activities, that might improve. So I think that digital sensing is the way to go. So for years, we've been waiting for people to collect on the field the temperature, humidity, and yeah, in some areas it's possible, right? But in some others, I go to the Middle East. They are currently in war in 4 of their states. They don't have time for these kind of things, right? However, we have hundreds of satellites around the globe looking at many things and taking variables of movements and temperature, humidity, vegetation. So I think if we could use more of that information to estimate and understand better, and of course with the help of the disease ecologists and the entomologists that can help us to understand better which are the drivers of transmission and what are the habitats for the vector, which are the environmental needs for these vectors, and then we will have this information that will help us understand the baseline conditions for these vectors. And once we understand that, then we can actually model what might happen with climate change. And this is the right time to do it, right? Because once we understand what's going on, then climate modeling will help us to use these assumptions. What if I increase the temperature 2 degrees? What if, right? And what might happen if there is flooding? What might happen if there is El Nino, like we had, like that we are explaining part of the increasing number of cases of dengue because we had an El Nino event since mid last year and just finished, and then El Nino ended, and then La Nina started, and now there are floods all over, and there is a lot of current rain and flooding in Brazil. So these models will give us, they're a very powerful tool to understand the dynamics of transmission and the dynamics of the habitats of these vectors and see how they can change once, when we are currently in the climate change. So I always say that climate change is a huge phenomenon and is going to have a lot of impact in the planet. So it will create a lot of disease in the planet. So it's increasing the temperature, we are having more floodings, we are having hurricanes. But the impact of climate change in humanity are diseases. So we are going to start seeing more vector-borne diseases, more lung diseases because of pollution. So think about climate change in humans as our diseases are the impact in humanity of climate change. So I think preparedness is now. We always wait for the next thing to come, but we are currently preparing for the next big thing. We don't know what it is, but we know something else is coming, right? So, and we can afford to wait until it happens to react and to actually look at those disease models. So before COVID, can somebody tell me which was the previous public health emergency of international concern? It was Zika, right? So if you remember, Zika, the public health emergency of international concern, showed to the world that mosquito-borne viruses can affect and can paralyze the world. We don't have the human-to-human transmission as we have it with respiratory viruses. However, when you have a vector that is widely distributed, then we might have another issue. People say, when Zika is back, well, Zika has never left. Zika is still circulating in Brazil, in Southeast Asia, Singapore, the Maldives. It's circulating everywhere. The thing is that it's not making it to the news anymore. But Zika has never left. And so what we need to do is to use these tools and technology available to help the countries and help the policymakers to prepare and to guide where the action should be taken. And also, we have new technologies coming up for dengue control or Aedes-borne arboviruses control. So we have vaccines. So we have a new dengue vaccine. We have a new chikungunya vaccine. We have Wolbachia infected mosquitoes that they are currently on the field. So in Brazil, there are several areas. In Southeast Asia, in other countries. Then we have the gene-drive technology mosquitoes. So if we don't understand what's going on with the wild mosquitoes, how are we going to introduce a completely new technology that then we won't be able to disentangle what's going on? So I think, well, I tried to put everything, a little bit of everything together, but I think the key here is collecting the data, analyzing the data, and do a feedback, giving a feedback to the people that are collecting the data. So there is actually a full cycle, and policymakers can use these models and an integrated approach of human cases, the lab, the clinical manifestations, so if there are more hospitalizations, the virus that is circulating, and of course the mosquito and the environment to have the full picture of what's going on.
Thank you. That was a really thoughtful insight into what's going on, and I think I just wanted to pick up on the Zika, because my final panelist has been working on Zika. Would you like to introduce yourself and have a think about your perspective on modelling in Zika and infectious diseases?
Thank you,
under
Kate.
Climate change.
And hi, everyone. I'm Merve Tunali. So currently I'm working in Swiss Federal Laboratories for Materials Science and Technology, and formerly I was affiliated with Boğaziçi University, and we are actually one of the partners of MIVAR project that Patty has just mentioned. And my work package, our work package in MIVAR project are focusing on water sanitation and mosquito breeding, and of course in relation with the transmission of the diseases. And here I want to highlight two of our recent research. So first one is we made a literature analysis. Actually, it also points out one of the points that you have mentioned. So we tried to define the factors that affects the disease transmission. And we focused on three different elements: environmental conditions, anthropogenic factors, and also social risks. And for instance, we defined some of the factors within each element that may promote the disease transmission. And for instance, elevated temperature or increased humidity, precipitation, we found that these factors increase the transmission. And also within the social risks, poverty is one of the factors that increase the transmissions as well. And secondly, we focused on sanitation conditions, and we conducted questionnaires in Brazil and also in Turkey to check the sanitation conditions and their risks to mosquito breeding. And currently we are comparing the sanitation conditions between Brazil and Turkey and their risk related to increasing the possible transmission. And I want to invite you to our poster to see our preliminary results. Thank you.
I think just that kind of highlights the importance of that systems dynamic thinking, you know, bringing in the social aspects, the biology, the land use, sanitation and climate change is all kind of interacting together. And I guess we have about 5 minutes left, and I just wanted to kind of open it up to the floor a little bit to kind of get your perspectives, or have you got any kind of pressing questions for the panel? We have an absolutely stellar panel here, and it'd be really great to kind of hear from you about some of the burning questions you have, or you want to kind of interrogate some of those big themes that we're kind of coming up with here.
Hi, Joseph Correa. I have the chance to introduce myself in the next panel. So straight to the point. Fascinating, but thank you very much for the very high level discussion that we had. But it's good to know and to be able to forecast what's going to happen. And the question is, do we really know what works in terms of disease control in different or transmission control in different environments? Those, Merv just said that the most vulnerable and the poorer areas are where the problem is higher, and then the transmission occurs in those areas. For instance, don't talk about inequality. It seems to be an incomplete equation. So I was just to really have evidence. Of course, the vaccines, I'm still waiting to see what's going to happen. But do we have evidence of what really works in terms of disease control? Cost-effective studies. Can you summarize that?
Who wants to take that? That's a loaded question.
I can take it, and then people can. Okay. So the answer is no.
Okay, next question.
So, no, the thing is that for many years and for many decades, we've been doing exactly the same without any evidence. So every time that there is a dengue outbreak, people panic, and then they buy a lot of insecticides, and then they start fogging. But they really don't know in which part of that epidemic curve it was. So sometimes it was already, the epidemic curve was already going down, so they did the fogging, and then it's like, oh yeah, the campaign was successful. Well, we really don't know. And as all of this was the quality accreditation and so on was done in the 1940s. There were not real randomized controlled trials or any kind of study to actually assess which was the efficacy or now the effectiveness of these campaigns. However, in the last 10 years, things have changed. With the Zika public health emergency, there was a lot of attention in what actually works and what doesn't work. And now there are several cluster randomized trials on the field, testing, of course, Wolbachia and all these gene-derived new technologies, but indoor residual spraying and spraying to bring more evidence to know exactly how we should guide and which kind of strategies or interventions are better for which kind of settings. Because now we are using a one-fits-all kind of strategy, and that's not how it is. Like depending on the setting, you might need, for example, Wolbachia, it might work wonders in Madeira, for example. It might work wonder in the specific areas, but well, I would like to see how Wolbachia works in Sao Paulo or in Rio, right? Or in big cities with very complex infrastructures. So with time, we are collecting better data on what works and what doesn't work, and will hopefully the next decisions that are taken are based on clinical trials and with good evidence.
Bruno, you wanted to come in.
Yeah, I wanted to comment this because I think that you talked about the emergencies that we've seen in the last years. And the thing is, this is an old problem, as you say, and very few advances have been seen in surveillance or intervention to vector control and also disease control. And what we learned with COVID is that we should gather forces and try to raise awareness in the scientific field and also the community. It has to be relevant. The problem is that the biggest problems are in places where the intervention can't happen. So it will always be there, and it will always spread to the other places, and we will always have this problem. And we need to see what to do globally. I think that we need to see this as a global emergency or something like this. I want to share a little bit more about the surveillance and the comments on collecting data and using data at the regional level. And as the colleague here has already spoken, we collect very fine data and very up-to-date data. We report it every week, and we use it to guide our intervention. We identify hotspots, and we know what is going to happen next week because we have a very big amount of data. And we have been, for the last decade, we have been doing several research projects trying to contribute with what we have to the development and the creation of knowledge. But there is always a problem. We have been working with technology advancements, with developing tools, with creating warning systems. Our data is available to do that, with the limitation that we don't have disease. Data on disease is not available for Madeira except for the outbreak. But the thing is, there is a problem in knowledge transference. We don't have tools. We have been doing research, but the tools are late coming to the field. I'm also a researcher. I'm a professor at the university, but we are lacking this connection because the problem in the field, and our technicians are here, is there, and we need to do something. And we know that probably the next emergency will be an arbovirosis. So we are very late, I think, and I think that we should congratulate all the opportunities that made us come together and try to use it more. So we are available for that, but we just want to say that we need everyone because we are dealing with a very serious problem, and we need to make others look at this. And at our regional level, we have political support to intervention, but the global level is much more important in battling this situation. So,
Yeah, well, the difference between COVID and arboviruses or dengue is part of the list of the neglected tropical diseases list. That list that would no disease would like to be, right? It's like the unpopular list for the kids in high school, right? So once a disease is placed in the NTDs list, the amount of investment and the amount of funding it reduces. But I will say that dengue is the least neglected of all the neglected because it has 2 vaccines. It has a lot of new technology coming up for vector control. So probably it will come back to emergencies, and then we can bring it. We can bring it back. It's not easy because we are competing with a lot of other diseases, and dengue and arboviruses usually, as you said it too, or all of us in the panel, they affect very vulnerable populations. So they don't bring the amount and the influx of funding that we saw with COVID. Like that's what you can do when you have a limited funding is wonders. We got how many vaccines in less than a year? How many interventions? That's what we can do when we have funding in all levels, in research, the country seeing as a priority, multi-sectoral coordination, like that's what you achieve when everybody's coordinating into the same goal. However, for some diseases that are endemic, they become part of the usual, right? And that's an issue. So we are working on it, and well, you are all advocating for dengue and arboviruses in your countries, in your institutions, and please keep doing it because we need this kind of involvement. But you've been still doing research on Zika. Thank you very much, because a lot of people, when we had the COVID pandemic, everybody stopped working on many diseases. So Zika had almost 40 vaccines on the pipeline that were everything stopped with the pandemic, and we don't have a single vaccine that have gone from phase 1 to phase 2. So
I don't want to stop this conversation, but Patty is looking at me. So I think we need to continue this conversation outside and at coffee. But I just want to finish with just asking the panel. I'm going to start down that end, so you've got a few minutes to think about it. Just one thing that you would do to try to get the modelling that's been done into policy? Like, how would you increase the uptake and communication of some of the models and the new technologies and AI and sensors? How would you get that into policy? What's the biggest thing, do you think? I'll start down that end. Sorry.
So maybe finding out the most suitable approach that we can use the available data and transforming these data into a more understandable way that we can communicate to policymakers.
Thank you. Dan?
Thank you. I will say this model should be easy to implement. It shouldn't, to be able to run these models, it shouldn't be extra work for anyone in the field, so it should be part of their own work. And also bringing these tools to the local levels, because remember that outbreaks start in communities and they end in communities. So these tools should be in the local levels for the people that are doing the activities on the field, so everything actually works and we complete the cycle of analysis, of collection, collation, analysis, and taking decisions.
Thank you. Saskia.
In fact, yesterday, Professor Tiago gave one idea that the way we can transmit this, for instance, this project to the politicians, to the government, is having really a pilot project that proves that it works. Then we can go there and say, look, here, you have to introduce that and put some money and efforts to go ahead. Otherwise, it's going to be very difficult because, in fact, it's quite difficult for us scientists actually to ask the politicians just that they agree that we are correct. And you mentioned that the floods now in the south of Brazil. And well, we've been saying that for more than 10 years. And look, the climate change is changing the way the precipitation is going to act there. And most of the models are indicating that the increase of the precipitation in that region. And this year was really a tragedy. So I think that's one thing that we discussed that's quite interesting.
Thank you, Ella.
I think something that's really important is that co-development with the politicians and also with communities. So co-development at all levels with the researchers, the people collecting the data, understanding how communities can use that data, how to translate the results of our modelling really effectively so that communities are empowered to do something, empowered to take control over the situation. And then also, I think, developing sort of digital tools, dashboards that really kind of visualise, you know, the risk or visualise what people can do to you know, reduce their risk of disease outbreak and the vector issue in the communities.
Thank you, Ella.
As for us, as for me, the suggestions done, I believe that's what we try to do at the local and the regional level every day with our intervention. But I again talk about the global action needed. And unfortunately, I believe that we are more reactive than proactive in terms of preparedness and disease response. So I think that the mosquito will do the work. What's happening in Europe with the expansion of the Aedes albopictus mainly is being responsible for a rising number of cases and autochthonous cases of dengue in all Europe. So I think that it's the problem is reaching more interventive countries. In Europe, for example, I've been in the last meeting a few weeks ago in ECDC, and we talked about how the countries are preparing for this. I think that now this is more of a problem for Europe now, and I think that will be a way of doing this transference of knowledge to the practice, and local and global political intervene. People will be aware of this problem this way. I think it's the only way.
Thank you. That was a brilliant point to end on, and that can I get everyone to thank our brilliant panel? That's really